Thank you so much for sharing those cases, for sharing your research ideas. I couldn't be happier to see all the hard work that you're doing, and as I mentioned earlier, the next steps that we see is that we get to take on here. I want to take a few minutes just to open up for questions to the general group.
It sounds like a big challenge is getting, let's say, trust and respect from the other specialists. And, we heard that was also an issue in the US for a long time. Any advice from listeners on how to facilitate that for our guys?
I will say every day they are building trust, right? Every time another team sees you not give up and do the right thing, I think a little bit is built. Many of us, even in the US, even every day now, still feel like we're sometimes fighting for respect and trust in emergency medicine. But so you're not alone. But I think everything you do every day is really making a difference, but it's hard to see in a minute. Dr. Portia, I see your hand up.
Hi, good evening. This is Portia from South Africa. Hi, I just want to say to the guys in Moz, what we're experiencing, I think the guys that were here in South Africa, they saw that we're experiencing the same. South Africa, we have a spectrum of healthcare. We're experiencing the healthcare from the first world to the third world. So in between, most of the public hospital, we're experiencing the in-between of the third world and the first world. So in the private sector, that's when you're experiencing the first world. And also I just want to say emergency medicine, it's an art. And also referring a patient, it's an art. You need to know what to say to the specialist and what not to say, what to hold back, and also how you say it. And also, I think also having the knowledge of your patient and being able to sell your patient to the next specialist is very important. What we're experiencing is what we're also experiencing here. Also now in the COVID era, I can share with you that in our EDs, we can stay with patients for even 2 to 3 days while still awaiting a bed. Those patients are in the ED. My ED currently, we have about, on a daily basis, we're having about 200% capacity. And there's no way you can stop patients from coming. They still come and we still accept them. You're still lucky that your ICU is still accepting your patients. It's very difficult. And often you find that you are the one who's taking that decision, whether this patient, I'm going to resuscitate this patient, do I have the resources? Sometimes we give up on patients because we don't have the resources. But what I want to say is that the knowledge will make your colleagues in other specialties to respect you and also have the art to sell your patients. And also don't be shy to ask for help. We are just a phone call, a WhatsApp away. You can just ask any of us, say, I have this case. How do I deal with this case? I'm stuck with this case for ages. At this moment in time, in our country, we're having a pandemic of mental health care patients that are using drugs. Very young men that can spend days in the EDs. They are literally residents in the EDs because there are no mental health care beds. So what we're experiencing, however, hang on there, is still a baby, a specialty in your country like it is in us. However, we are gaining more respect from our other specialists because they see what we do for the patients and the patients are surviving while still in our care. Sometimes a DKA patients do get out of a DKA while still in the ED department, having not reached ICU, not even going to ICU. From the ED, they go to the ward, few days later, they go home. So hang in there. I think what you need is more space. And I hope I might be able to visit you one time again and to see how far you have gone.
Thank you, Portia. Hello.
Hi, I have to introduce this man before he is allowed to speak. Dr. David Wright is still my department chair, even though I have moved away from Emory. He was my mentor and has been my boss for many years, and has actually been a supporter of improving emergency care in Mozambique long before I moved to Mozambique. It's so nice to see you here. I thank you for making the time to join us, and I welcome any wisdom you have to share.
I don't have a whole lot of wisdom, but thank you, Abigail, and thank you for all that you've done in Mozambique. And it's wonderful to see the residents. When we first started in Mozambique in early 2000s with Scott Sasser and Catherine Lynch and a variety of others, it was about just sort of building capacity. And now to see it as a residency that's fully formed is really heartwarming. And I know that you're going to change the world for Mozambique with emergency medicine. It's going to take time. My advice to you in how to do this is, as Naomi had said, the best way to gain trust is through your care and through your knowledge, and always fighting for the patient. If you're always fighting for the patient, you're always going to be on the right side. Don't try not to let it be about personalities. In fact, if you can, the critical care folks that are giving you the hardest time, go out to dinner with them. Buy them a glass of wine or something, and meet them outside of the hospital setting if you can, because once that socialization and friendship begins to kick in, you'll see that you're starting to gain a lot more trust in them, and so that's one way to do it. It's a little bit of a workaround, unfortunately, but yeah, as Naomi said, the best way is just through your care, and people will begin to trust you and believe in what you're saying.
Thank you, David. David also was part of the project of hosting ESIO before COVID, when he came to on his US tour and spent some time with us at Emory and a Grady Hospital in Atlanta. Kevin, I don't know, we're past our hour. Welcome. Do you want to say a couple of words to wrap up?
Sure thing. This has been a tremendous hour and a half almost now of getting to reconnect. I just want to highlight a couple of things. First of all, none of us would be here without each other. I think this is truly a wonderful partnership. The residents putting the trust in Pledge Health, our donors and board members supporting us in making these developments possible. It really makes me one of the happiest people alive right now to see this together and to see everyone on this call. I do want to highlight some of the impact that's been had. I think to piggyback on the last statements about the early beginnings and how we've built into a residency and now we're taking on these new challenges. One of the key elements of that has been Abigail's presence in Mozambique for over 4 years, putting in the work. And it's something that we've, as an organization with Pledge Health, are now working on carrying that momentum forward and maintaining the presence, because I really believe having the full-time presence in partnership with our specialists, with the residents in Mozambique, is what makes this sort of long-term project possible. And with that said, there's always room, and volunteers and people are always welcome to come be part of this. And many of the individuals on the call, we heard from Portia earlier, have made a tremendous impact in the lives of these residents and specialists by coming even for just 4 weeks or even 2 weeks in some cases, and still having a tremendous impact, incremental, but essential to the long-term success that we've been seeing. And then those who are just supporting and providing donations have made a huge difference. Obviously, we heard about the ultrasound machine, the Butterfly, which was actually something that was sought after by a volunteer who was there in September with us, who felt that it was so important that that happened, that she took it on herself to fundraise, to get the Butterfly in, and as a result, they're getting to use it. And I got nudged along that pathway because I was a little bit slow in facing other priorities for our program. And so I just highlight that to show the importance of being on the ground, of our volunteers on the ground, and what they've done to help make a lasting impact even after they've left their short visit in Mozambique. So thank you again. I really appreciate you joining us this morning and hearing these stories. I look forward to being in touch and hearing more about what's going on. And I welcome any individual feedback or questions, as you can also reach out to each of the residents, and I'm happy to connect those on this call if you don't know how to individually connect with each other. Thank you again, and have a wonderful weekend.
Thank you. Bye. Thank you.
Bye.
Thank you, everyone.
Thank you.
Thank you, everyone who's taken the time to join us.
Thank you.
Many various continents who took the time today. Thank you.
Bye now. Bye.
Bye.
So-
Next week.
Thank you.
Hmm?